Knock, knock. Howdy, folks. Hello from Nashville. Welcome to Dr. Ben and Friends, the podcast dedicated to putting the med in comedy. We're shining a big, bright spotlight on everyday healthcare heroes and comedians. So we're so glad you're here. I'm your host, Dr. Ben, board-certified orthopedic surgeon and stand-up comedian. I prescribe prescriptions and laughter and an occasional anti-inflammatory. Today, co-hosting is the unstoppable and awesomely funny Miss Brinn Daniels.
Hi, nice to be here.
Yes, and our healthcare hero rock star is Dr. Jameil. Dr. Jameil's an
Hey, thanks for having me.
incredibly talented board-certified general surgeon who's fellowship trained in bariatric surgery. I can't wait to hear more about that. Bariatric surgery, we're going to learn about that. He's making miracles and we're telling jokes here. So that's right. Dr. Ben and Friends podcast prescribes 100% comedy without the copay. So we're celebrating healthcare heroes and comics who dedicate themselves to making this world healthier and funnier. So grab your stethoscope or coffee and let's buckle in. A special thanks to our sponsor, The Needles Group in beautiful Marco Island, Florida. As a doctor, I know a great needle when I see one, and these realtors are the best in the business. Buying or selling? Let The Needles Group inject some serious value into your property game. TheNeedlesGroup.com. All right. Dr. Jameil, Miss Brinn, do you two know each other?
No, we've never met before. Nice to meet you.
Nice to meet you too.
All right. Well, Dr. Jameil, Miss Brinn is a very talented comedian. She's also a filmmaker, and she's a university professor in filmmaking. And she produces shows for the Clean Comedy Collective, does stand-up comedy. And we're excited to hear more about what she does. So she has a big heart for comedy and filmmaking.
I do too.
All right, great. I can't wait.
Frequenter at Zanies, actually.
Are you really?
Yeah.
Oh, yeah, you're
Love
the
it
true
there.
deal. Yeah, that's great.
Yeah, so, yeah.
All right. Tell us a little about yourself,
What do
Miss
you do?
Brinn.
Yeah, so I started comedy during COVID, which was a very great time to start. The biggest comedians in the world were doing backyard shows, and if you didn't already have a career, you pretty much couldn't do it. But it was nice for me. I was able to write for a really long time before I got to perform. I started working with the Clean Comedy Collective pretty quickly I would say around 2022, maybe even 2021. And then I joined them as a producer in 2023. So I've been producing shows for them for the last 3 years now, actually 3 years this month, which is great.
Anniversary.
Anniversary, big anniversary. And I currently produce a show out of Spring Hill at this beautiful Christian business coffee shop. And we have a rotating comics, and it's on the third Saturday of every single month in Spring Hill.
All right. And what's the name of the coffee shop were you?
Just Love Coffee in Spring Hill.
Shout out to Just Love. Go check out that show. That's a great show.
Yeah, you've been on the show.
It was a great time. So check out that one. And then, I, during the pandemic, tried doing comedy via Zoom, but turns out I'm not remotely funny. Not remotely. So Dr. Jameil here is a general surgeon and a bariatric surgeon. Mm-hmm. Brinn, any idea? What do you think he does every day? Is it like Grey's Anatomy or?
I am not.
What do you imagine?
I am not very medically inclined. So I hear bariatric and I'm a word person and I think geriatric.
Okay.
Common
So maybe somebody
misconception.
older or bariatric pressure, I think. So
Okay.
I'm thinking older people have a lot of gas. Is it anything to do?
I'm a general and bariatric surgeon.
Okay.
So I practice surgery on a lot of older people. My gallbladder this morning was late 70s, but bariatric surgery, pressure. It's pressure on the knees to be overweight. So overweight surgery, weight loss surgery, basically. So gastric bypass, sleeves, and then, the big thing is revisional surgery. So a lot of those patients had surgery 20, 30, 10 years ago, may need a second operation to fix this or that, or help with weight regain. So I do a lot of that as well.
Oh, wow. Yeah.
So
you're helping real people.
That's the goal. Yeah.
I hope that when I make people laugh, I'm helping them, but that's amazing.
I think actually you probably do a lot. So yeah. And I wake up every day and I listen to comedy on just my Facebook reels, and I have a list of comedians I listen to. So it definitely starts my day off
I'd love to hear
Great.
your list. Can you give us a couple?
Yeah, so I've seen Shane Gillis live. Mark Normand is the newer one I've been watching.
Yeah,
a
very
lot
funny.
of. They're not as
Very
clear,
funny.
but super funny.
Comedy.
Dave Chappelle. Yeah, exactly.
Yeah.
Comedy.
Kevin Hart.
Yeah.
I've seen Dave Chappelle a couple times when I was in med school, and then
He's so great
amazing.
live.
He's
I saw
amazing
him
live.
in
Different
like
than
the
specials.
early 2000s
Yeah,
at Caroline's Comedy Club in New York when I was
Yeah.
in school. Oh my gosh.
Yeah, he's,
So fantastic.
different for sure. Like great experience. And then who else? The good
He
ones.
holds
I've
court
seen
when
Dr.
he-
Ben 5 times. Actually.
Wow.
All right.
Yeah, huge
Could
fan.
be a record.
Yeah. Could be a
Very
record.
supportive. It is a record. And then who's I saw you had a very, I think, pretty famous guy on your last
Show.
one.
Okay.
He's on Dave Ramsey's show all the time. He's a
Deloney.
therapist. Deloney, yeah. He was really
Oh,
good.
yeah.
He was super funny.
Yeah.
Yeah. So I love comedy. It's great. I think it does a lot of things,
That's great.
good things for people. So yeah.
You do a lot of serious stuff all day. So I imagine it's probably nice to start with something a little lighter.
Yeah. I mean, yeah, I own my own practice. So it's, believe it or not, I think that's the more stressful part of my day is the,
Running a business.
hiring and firing, running a business. The surgery part is like the fun part of my day. I love that part. So, and I think Ben, Dr. Ben could agree with that too. But yeah, that's the best part of my day for sure. But it's good to get a jump start on the day with something like comedy. So yeah.
Yeah, but all the other stuff, the dictation of medical records, that's the bane of our existence.
Yes.
Well, we're going to jump right in then, hearing
Yeah.
more about what you do,
Yeah.
Dr. Jameil. We actually have a question from a listener.
Okay.
So a listener wrote in, and it's Adam S. from Brentwood, Tennessee, not California. We'll just jump right in. How do bariatric surgeons feel about the GLP-1 medications like
Yeah.
Ozempic and Mounjaro?
I get asked
And are
that.
they taking food off your plate, so to speak? So what are those exactly for
Yeah.
the listener and for dumb orthopedic surgeons that aren't sure? What's GLP?
Absolutely. So I get asked that all the time. And it's kind of funny you mentioned COVID with starting a comedy career. While I was finishing fellowship when the GLP-1s were just taken off, and we saw, bariatrics saw like a 30% drop in our volume of surgeries because they're great. So what are GLP-1s? So GLP-1 and GIP, which are the two hormones that are in the medications these days, it's a class of medications, actually been around for a long time, since like 2005, but not like the weekly injection we have now, are gut hormones naturally produced that help with digestion, help with control of your appetite. So this is a comedy show, so there's a joke I heard in med school from one of our professors. They created Ozempic. The plan was to treat diabetes, use this GLP-1 gut hormone agonist to decrease the A1C, help diabetics become better. But just like Viagra, that was invented for hypertension or for high blood pressure. Didn't work so well for hypertension, but they were in for a big surprise. And so it's the same thing. We actually,
Heyo.
there you go. So
It's a clean show. Keep
it's
it
a clean
clean.
show. That's right. That's true. So anyway, long story short, Ozempic worked great for diabetes, but I also noticed a lot of people were losing a ton of weight. So then they got branded for weight loss, and it was called Wegovy. So Ozempic and Wegovy are a drug called semaglutide. It's one gut hormone agonist, GLP-1. That's why the name or the class of the drugs is actually GLP-1s. Then another medication came out throughout the last 5 years called tirzepatide that actually acts like GLP-1 and GIP, and I say act like it helps your body produce more of these two hormones, and that also helps people lose weight, improve their diabetes. The brand names of that medication or those medications is Mounjaro and Zepbound. I bring up the names because it's very confusing for patients and for people to understand, like, why are there 6 names for the only 2 types of actual peptides? Well, that's why. It's just the branding of the medication. The way they work decreases your desire for food. You eat less, it slows down your gut. You eat less, you have less food on your plate. And basically, people lose weight because they just are having less calories. And to your second question, when I was in fellowship and saw the decrease in volume and bariatric surgeons struggling, I was like, I have to get on this. It's clearly a very good treatment for obesity and for diabetes, just like bariatric surgery. And so my practice does 50% at least. Half my patients are on some sort of GLP-1 medication to help them with their obesity. So it's been a really rewarding, honestly, part of my practice.
Wow.
So, yeah.
And so has that reduced how much surgery that you have to do? I mean,
Well, I started from scratch. So I went from a 0 to now I'm doing 10 to 20 cases a month. It's actually helped me build my practice up a lot because they trust me, they get to know me. And so they're like, the GLP-1's not working for me. My BMI is still 40 plus. Is there another option? I'm like, yeah, I actually can do surgery for you as well. And so I leave it up to the patient to decide, what do they want? How do they want their obesity treated? Mm-hmm. And so
nobody wants a one-trick pony doctor.
No,
you'd have a couple tricks up your sleeve.
a couple tricks for sure. So that's why I love being an obesity doctor because and the next thing I'm starting in March of this year will be endoscopic procedures to help with weight loss too. So that's incisionless surgery basically. So I think it's a fascinating field. There's just so many options.
Wow. Yeah, I can't wait to hear more about those too.
Yeah.
And just listener too at home, if you're scheduled for an elective surgery, we need to know if you're on those medicines because they want you to stop those well ahead of time so that the food can move through your stomach. We don't want to operate electively on patients with full stomachs.
Absolutely.
All right, thanks team. Now it's time for common sense healthcare ads we wish existed from Dr. Ben and friends because real sponsors don't know this awesome podcast exists yet. This episode of the Dr. Ben and Friends podcast is brought to you by Heartburn Hero Hot Sauce. Heartburn Hero Hot Sauce. Fight fire with fire. This spicy sauce cures heartburn by making it afraid to come back. Endorsed by dragons everywhere. Not for the faint of stomach. Make sure to use promo code DRBenComedy at checkout for 25% off your next Heartburn Hero Hot Sauce. Dr. Jameil, so tell me, who is a good candidate for bariatric surgery? Can you talk about the BMI or body mass index and who exactly qualifies and who's a good candidate?
Absolutely. So BMI is body mass index, like you said. And so right now, there's two ways to look at it. I'll keep it brief, but basically there's what the insurance requires and what our society, the American Society of Metabolic and Bariatric Surgery requires. Insurance always lags what real doctors want, because you guys know why. I mean, they want to save money somehow. But so if you look at what medically we think is necessary, it's a BMI of 30 with an illness like diabetes, hypertension, sleep apnea, etc., or a BMI of 35 plus. In terms of most insurances in Tennessee, if not all, I think except for one, it's BMI of 40 or BMI of 35 with a comorbidity or an illness like diabetes. When a patient comes to me and, so with the GLP-1s, that's throwing a whole nother wrench into everything. I really look at the patient, their lifestyle, can they tolerate surgery, and then how old are they? If they're 25, most commercials, most doctors, most of those like ads you see on Instagram don't mention the fact that you have to be on a GLP-1 the rest of your life. So if you're 25 years old, I really just start to discuss that with them. And for some reason, they're like, I don't want to be on medication forever. Maybe surgery is a better option for me because it's more weight loss and it's permanent.
And listener, just briefly, that BMI, body mass index, it takes your height, your weight, and your gender. And then if you're in a range like 18 to 25, that's healthy. If you're under 18, it's underweight. And then over 25 is overweight, and over 30 is obese, and then over 35s.
Classes of obesity. So class 1, just like you said, you're perfect. 30 to 34.9 is class 1. 35 to 39.9 is class 2. 40 plus is class 3.
Okay.
So, yeah.
I've been lots of different weights in my day, but I'll tell you what makes me upset is that it's just like drinking alcohol, the BMI. It matters so much what your height is.
Yes.
And I'm 5 foot tall. So I am like living on a razor's edge with all of that stuff.
Yep. Not much room to move there.
No.
And with joint replacements too, a lot of times I can't even schedule the joint replacement if the BMI is over 40. So then I have Dr. Jameil help.
Orthopedic surgeon's a bariatric surgeon's best friend.
Oh.
Because we got to get the BMI below 40 to replace your joint.
That's right.
Your knee or your hip.
Yeah.
So, all right, Dr. Jameil, can you kind of walk us through some of these various procedures that get thrown out there, like the gastric sleeve or the gastric bypass, duodenal switch? Like, what are all these procedures?
Yeah.
Some Roux-en-Y procedure.
Yeah, absolutely. So there's
dumb it down for the orthopedic surgeons
I'll do my best.
And the comedians, for sure.
Comedians out there.
So the stomach is basically an organ that's probably just under the size of a football when it's distended. And so the first one is a sleeve. There's a gastric bypass or Roux-en-Y. You have to say both names because patients hear different things and have heard different things. So Roux-en-Y gastric bypass, the duodenal switch, and then there's a newer one that I've just started doing called a single anastomosis duodenal ileal bypass, or a SADI-S. And so I'll briefly talk about them all. That last one, the last two are pretty complicated, but the two main ones I do are the sleeve and the bypass. Okay. So the sleeve, I cut out about 70 to 80% of the stomach. You take it from the football to a banana-shaped stomach.
Wow.
Okay. And so you can imagine by doing that, you really cannot eat that much. There's also a hormone in that part of the stomach that I'm removing permanently called ghrelin. That's responsible for your appetite. It lowers your appetite by taking out that part of the stomach. So
that's a great name for a hormone
that
does something so bad. It's so close to Gremlin.
It sounds like a movie. The Gremlins.
Exactly.
There's got to be a joke in there for us, Dr. Ben.
That's right. We'll work on that.
Yeah.
I love it.
But yeah, and then the bypass, I basically, this is, I make a small little stomach pouch from the stomach, and then I reroute your intestines so that you have restriction. You can't eat that much. And then you also can't absorb as many of the calories. So that's a Roux-en-Y gastric bypass. The other two procedures, much less commonly done. They're very malabsorptive. It's really for severely obese patients, over BMI 50, 60. And so you could get there pretty quickly, but with your height and everything. But yeah,
yes,
it's for, severely obese patients. I've done 3 SADIs in the last 2 years, and basically you do a sleeve and then you do a more malabsorptive procedures to the small intestine. And so the whole goal is restriction and reduce the absorption of the calories that people eat.
If you just reduce the absorption, does that mean are you going to the bathroom more or?
Yes.
Yeah.
So you're pretty good at this. So yeah, it's,
I can make some gross deductions.
Yeah. No, exactly. So the more malabsorptive it is, the more they do actually have diarrhea issues sometimes, and duodenal switch and SADI especially. It's really malabsorptive in terms of the range of the procedures I mentioned. And so they actually do have 3 or 4. I mean, can I talk about poop on this show?
Sure.
Okay, great.
It's
3 or more.
Clean, but
not as clean.
Hitting them with the old duodenal switch. That sounds like horrible.
It's So no, it's so that's why I'm not going to do a bunch of those unless they really need it, because they're in the bathroom more. Yeah.
I got to know more about the duodenum. That is such a fun word to say.
Yeah.
What does that function? How does that function in your body?
What is the duodenum?
Yeah. So it's the first part of the small intestine, and you have the stomach, esophagus. We're basically just a big tube, right? So esophagus, stomach, duodenum, and then jejunum and ileum. So duodenum, jejunum, and ileum are the 3 parts of the small intestine. The duodenum is the first part. It's relatively short. It's got 4 segments. And so I just come across the first segment of it with a stapler and do the rest of that procedure. It's really important for absorption. Your gallbladder and pancreas and liver all hook up to that area to keep it simple. And so a lot of those enzymes and proteins come, meet up at the duodenum, and then that goes into your body. So
if I'm having stomach issues and I'm in polite company, could I say, "Ooh, my duodenum's acting up," before I run to the restroom?
Absolutely.
I love it.
Yeah.
That's good.
It's good to have these things in your pocket.
Right.
That's right. Yeah.
And then it doesn't sound so.
I'd go with, my pancreas.
Oh, could be the pancreas.
Do that one. Yeah.
Gallbladder.
Yeah, that's right.
All right.
I
heard
it's fun.
Diarrhea is hereditary. It runs in your genes. I don't know.
I think so.
Dr. Jameil, so walk us through the kind of typical patient's journey of having this preoperatively.
Yeah.
What kind of, do they have to modify diet or see psychiatry or anything? Or how long does the surgery take? How long are you in the hospital? Can you walk us through briefly?
Yeah. I mean, so basically it's a range, so people at a minimum have to be in a program for 4 months.
Okay.
But
what do you mean by a program?
So we have my office runs a complete bariatric program. I have access to psychologists. I have 2 dietitians I employ, 2 physician assistants that help me see the patients. And so they have to, like you said, do a program, get a psychology clearance, work with the dietitians, and at a minimum 4 months. But, I moved to Tennessee, never heard of sweet tea in my life, and got here, and it's a serious addiction. So some patients require 8 to 10, 12 months to get through till they can kick these habits, right? So they may be in a program preoperatively for a while. And then we do the surgery, usually in the hospital for 24 hours. I've started to do some same day sleeves and things like that where they can leave the same day because it's gotten so safe. And then they go home. And then after, biggest bang for your buck is after, all the follow-up, making sure they take their vitamins, not having too many diarrhea spells or duodenal issues, like you said, and making sure they're maintaining their weight loss. So it's a lifelong thing. I mean, they can't go back.
Is there a number one? You mentioned sweet tea, and I think that probably is really difficult here in the South. Is there like a number one or like top 3 things that people have to give up? Like,
yes,
in order?
I mean, it's liquid calories. Like,
yeah.
Which
I've learned is worth, soda or sweet tea?
They both have sugar.
It's a lot.
Soda's addictive. I mean, it's really addictive. And so, I mean, soda, sweet tea, juices, like, the other thing that's kind of funny when I moved here, you can get nicotine in your body in so many different ways that I didn't even know about. So I'm gonna make them stop all of that before surgery too. But yes, liquid calories.
Healing,
yeah.
Wound healing
Same as
potential.
ortho surgeons do. So sodas, sweet teas, juices, coffee with whatever kind of creamer. And that's like the number one battle always. Yeah.
But they could do like artificial sweeteners?
They can.
Like tea
stevia. I try and push them off those things, but it's a really bad addiction. So like, for a lot of patients, just switching to a non-sugar version of their drink, like unsweet tea or unsweet tea with stevia, or I mean, we don't like Diet Cokes and stuff like that, but trying to get them to a healthier point before surgery.
Okay. And then on average, how much can a patient expect to lose, or like a certain percentage of, or get them down to a certain BMI? Or?
Yeah. So we call it excess weight loss. So the way I describe to patients, if your normal BMI is 25, anything above that is excess. So a sleeve is out of the procedures I mentioned, the lowest, weight loss procedure. They'll lose about 50 to 70% excess weight loss.
Okay.
And then the bypass is next, about 60 to 80%. When you get to the duodenal switch and SATI, it's a little more than both of those procedures. And so, but people range. And then just comparatively, the GLP-1s don't get, for most patients, up to the weight loss you'd expect even with a sleeve. So in really good tirzepatide patients, they can get like 20% total body weight loss. So
is that more for fine tuning then, instead of kind of big issues, or does it depend?
When they come to see me, it's like, I'd never want to talk about surgery ever, so don't even bring it up. And I'm like, okay, we'll put you, even if they're BMI 60, I want to help them lose some weight one way or the other. So if that's what they want, that's what they want.
So you're getting more people asking for the GLP-1s than
a lot more
than the stomach stapling or whatever.
Yeah, exactly. Yeah. And that, I understand that. I mean, who wants surgery right away? Like that's, it's a big deal. So yeah.
I don't know. Surgery sounds better to me. I'd love to eat like a bird. Like, wouldn't that be nice?
Yeah.
I do not eat like a bird currently.
Yeah.
I'm like a bird. But overall, afterwards, like the health picture, I'm sure
everything improves. Diabetes. I mean, 75% cure with a gastric bypass after surgery, even if they regain the weight. Less knee replacements for you. I mean, joint pain's better, back pain's better. Hypertension, sleep apnea can be gone. Cancer risk goes down significantly. So weight loss affects everybody.
Mm-hmm. And what about because COVID, right? That was, it adversely affected overweight people more.
Significantly. So, I was like, a lot of the patients tell me, my first question is, how long have you been dealing with weight? COVID's an answer for a lot of patients because huge depression, immobility, couldn't leave the house, picked up a lot of, eating, DoorDash, another big one, stuff like that. So these mobile devices that we can just order food right away. So COVID was a big one. Yeah, absolutely.
And then the patients that come to you, what if they're kind of on the fence about, like we said, surgery? I don't know if I want surgery. What's the conversation you have with them about kind of alleviating concerns, asking questions? What questions should our listeners be asking a bariatric surgeon? Yeah.
I think, I took the approach of like center on the patient. So essentially ask, okay, just like you said, what's the most effective with my age? Like, what do you think is the best option? Do I really have to stay on this medication forever? If anyone tells you don't, they're The data does not support that. So you really technically have to be on it forever, just like
that. He stopped
insulin.
Judiciously short of saying they're lying to you.
Maybe, yes.
The data
they are
would
lying
not support.
No, that's good.
And then, what are the side effects of the surgery and what are the side effects of the meds? Like which one, and so some people
Which one can you live with?
Yeah, correct. Is this really reversible? Well, the bypass technically is reversible. The sleeve is not, that part of your stomach's gone forever. And then, I think it's fair to ask, how many of these have you done and what are your complications? People ask me, I'm straightforward with them. Good. And the other thing is I tell them, if a surgeon says they've never had a complication, they are lying to you. So I've had my own, just like any surgeon, we've all had those things happen.
Yeah, the complication rate's never zero, so they've never,
right.
They're lying or they've never operated before.
Correct, exactly.
So no one's complication rate is zero.
I've gotten to the point where even pizza I have complications from. I have a piece of pizza and then because I don't have an allergy to gluten and I don't have an allergy to tomatoes.
Yeah.
But I just kind of have a little bit of a reaction to it where I don't sleep.
Yeah.
And I still eat pizza because pizza's delicious, but you have to.
It's amazing. Yeah.
Pizza's too good.
Causes insomnia?
Yeah. Isn't that weird?
Oh.
Yeah.
I'm lactose intolerant, so I have little problems with my duodenum when I eat pizza.
You need that old duodenal switch.
That's right.
Thanks, team. Now it's time for common sense healthcare ads we wish existed. From Dr. Ben, because real sponsors still don't know this awesome podcast exists yet. This episode of the Dr. Ben and Friends podcast is brought to you by Digestion Dynamo Drink. Chug this elixir for perfect gut health. Turns your tummy into a well-oiled machine, literally, with optional oil changes. Side effects may create burps that sound like symphonies.
And Dr. Jameil, let's talk a little too now about technology and like robots and the Da Vinci that I hear about. And, both in general surgery, bariatric surgery. What role has technology played? Where is it going?
Oh, good.
Is it going to be taking your job?
Too?
Yeah. Basically. I don't even do the surgery anymore. It's awesome. I just plug it in and I get asked that all the time. Like, are you doing the surgery? I'm like, so the robot is great. It's a fantastic instrument. There's one main one that most hospitals use. There are more coming out for, competition and maybe some potential advancements. Basically, I put in these little instruments called trocars on the patient's body. I hook the robot up to it, and then I go and sit kind of like a video game on something called the console, and I'm literally just sitting there using my hands and
looking
fingers,
at a monitor,
looking at the patient's abdomen. You're just kind of sitting up like the gallbladder this morning. That's how I did it on the robot. And the robot.
You look like you're playing a PS5 right now.
Exactly.
Okay.
Straight up, like playing a video game.
He's over in the corner.
But I'm actually sewing the bowel together. So it's awesome.
We actually have camera controls like that, where it's like a literal PS5 controller and you can control which way it goes and up and down.
Yeah. Very similar.
So maybe I could do your job because I wouldn't trust
some gamer out there is going to be doing.
Well, you're going to be later. So
gamer's going to be taking your job. And now describe this robot because people probably have some image in their mind of when you say robot.
Yeah.
What is this robot? It's not an actual.
How would I describe it? It's not an actual robot. It's literally.
It has all these arms coming down.
It's got these arms that connect to the patient's body after I put in the insertion sites to the patient's body. I put those in so that's done safely.
How many arms? Because you said 4. Arms.
Yeah.
That's terrifying. Yeah. I don't want like a robot spider giving me.
No, it's not like the Matrix where like the thing goes in your belly and does it.
Or like Aliens where it pops out the other way.
Oh. But it's like 4 arms. They hook up to the patient's abdomen, and then once they're hooked up, it's literally simultaneous. When I move, the robot arms move, and so stapling the bowel.
Very precise.
Yeah, super precise. It's awesome, and I can do a bypass now in like. I'll just be honest, my fastest one's 36 minutes.
Wow.
Really proud of that. But safely 45 minutes to an hour to do a gastric bypass, which, 10 years ago, big incision, ICU, like way different.
So the 36 minutes wasn't safe?
It was safe. She did awesome.
Now, could these be done remotely?
I honestly, I bet they can't. I bet that technology is coming in the next 5 years. Actually, Elon thinks we won't even have jobs in 5 years. So
what do you think?
I got to start comedy. Got to do something else.
They're taking those jobs too.
Yeah. I think that's crazy. So you won't even trust a robot right now. I mean, I think it's just, I'm sure the technology is there, but there's no human being that wants, a robot talking to it about its surgery and then doing it, So I just think there's not that human connection.
Mm-hmm.
Yeah.
And I use a robot.
Movies. Yeah.
I use a robot in orthopedic surgery, but it's nothing like your Da Vinci. I have robot envy, I often say.
Yeah.
Ours is very rudimentary. It's nothing as precise as yours. It's just kind of an arm that has a saw blade to make geometric cuts, but yours can do a lot more. So
yeah, I mean, but it's also helped your precision.
Right, it lines it up.
Right?
Takes a little the human error out by eyeballing it. It lines it up perfectly.
Yeah. That's awesome.
Now, you mentioned endoscopic procedures too. Can we talk about that? What do you mean by endoscopic, and what procedures can you do?
Yeah, so I'm going to be doing endoscopic sleeve gastroplasty, or ESG. And so instead of me making incisions to do the sleeve that I talked about, I'll basically go in the patient's mouth, down the esophagus, into the stomach with this 1 centimeter, 1.5 centimeter device. I tell patients it's like a colonoscopy, but from the other side. So, and then I use that to literally suture together layers of the stomach. So instead of from football-sized stomach being able to actually have food in it, now it's much thinner, but it's held together by sutures on the inside. So it's a sweet procedure. I mean, I'm going to do my first 2 coming up in March. I've done a lot of training for it. I do a lot of endoscopy already, so I do a lot of EGDs already. And so it's just another kind of a newer procedure that just got approved by our society this year. And so, I think it's been a great option for patients. So I would call it a stomach tightening procedure.
Stomach tightening?
Yeah.
See, that sounds pleasant, but not the way you described it. They're asleep, right?
They're asleep. Okay. They're asleep. And I would say it's like, it's your best secret, right? No one's going to know that you even had a weight loss procedure. So
no scar. That's
right.
a good point.
Yeah.
Stomach tightening.
That's right.
Dr. Jameil, how do you make patients feel kind of comfortable before, during, and after surgery? I imagine people are very stressed about it, nervous.
Yeah.
They call that bedside manner, right?
Do you call in a buddy that's a comedian to come tell some jokes?
Always, yeah. Cheer them up.
Get some laughs.
It does work, yeah. I mean, how do you do it? You've been doing this a lot longer than I have. And
I like to
surgeon.
Tell jokes.
Yeah.
Laughter is the best medicine, unless you're treating bowel or bladder incontinence. That's probably the worst.
It's the worst medicine. Absolutely.
That could set off the duodenal switch. That's what I've heard.
I actually called the incontinence hotline today, and they told me to please hold. But
how did that go?
I imagine you have a great bedside manner. I'm sure that kind of.
I mean, I love my patients. We get to know each other. Like, I'm pretty informal, so that that helps. And like, I don't go over the risks and benefits the day of surgery. I did it 2 weeks before at the pre-op appointment. So I'm like, I'm not going to talk about that the day of. And then bedside manner, and just remind them that I know what I'm doing. I've been doing this, and I'm going to take good care of you.
Mm-hmm. I had a mentor in training, and you probably abide by this anyway, but said that patients don't care how much you know until they know how much you care. And so I think just kind of, they don't really care about hearing all the, how big your brain is and stuff. But
that's why we don't want the robots. We know they don't care.
They don't care.
I've seen enough movies to know that there's the one rule, right, where they're not supposed to do any harm. And then what happens in every movie?
That's right.
They do all the harm.
What's the one with like Will Smith, I think, and it's got
iRobot. Yeah.
Dude, that's coming, dude.
It is coming. It's terrifying.
Scary.
Did you guys see the recent where they put all these AI assistants had their own like Facebook kind of like chat thing? Where they were talking smack about all the people that they help.
Oh, yeah.
Yeah, that came out this week or last week.
I've read it
was crazy.
It'll lie to people. I mean, it can start to
make up.
Yes.
Yeah.
It's just going to make up, fabricate.
Yeah. And I mean, there's the one story of like that's depressing. I don't want to talk about it, but yeah, it's
And my bariatric surgeon might lie to me, but at least there's a chance that he cares a little bit, right?
Little chance.
There's no chance with that robot.
That's right.
Maybe they'll program some compassion in there. I don't know.
Oh yeah, that's a good idea.
So how do you
get on that?
Decompress after a stressful day?
Man, I'm telling you, I love comedy. Like I will sit there and just watch.
Awesome.
He's pandering.
Yeah.
No, I'm kidding.
Mark Norman, whoever, just watch their reels.
Favorite guest.
That's right. I'll be back. Comedy. I don't have my social media apps on my phone during the day because I'm like busy, so I don't want to be distracted. And then I'll just download, watch for a little while. And
you're not one of those TikTok dance doctors? You're
not
doing
yet.
that?
I've thought about it. I do have a
He's
TikTok.
got moves like Jagger.
That's right.
You do have a TikTok dance?
It's called, well, no, not a dance yet, but I have a TikTok called Bariatric Bro. And
Oh
so
my gosh, that's a great name.
I love
the
it.
patient found me yesterday on TikTok, and that's why she came to see me. And I was like, oh, I got to start doing this
Wow.
more. But
They're saying that
Follow
with the
Bariatric
universities. Yeah, follow
Really?
it. Yeah.
Yeah.
With universities, that a lot of their admissions people are having to get on TikTok because that's where the kids are.
really,
I
Yeah.
believe it.
I was like, I do not want to. Oh, I don't
They
want to
gotta
get
keep
on
up.
there.
Yeah.
You do.
Right.
You have to keep up. I mean, that's where they are.
That's true. Dr. Jameil, you love comedy. Do you have any questions for comedians or?
How do you do it? I mean, you've asked me to go up and do a 4-minute bit. I'm like, there's just no way.
Dr. Jameil actually thought about doing stand-up.
for
and
about
I encouraged
20
him to.
seconds.
I encouraged him to try
That
to
was
The
open
it.
whole
mic.
20 seconds, I was like, I'm going to do this. And then,
Because those guys you mentioned, they make it look so easy.
yeah.
Doing like hour specials, just getting up there and talking.
But I know they've failed before, right? Like everyone
Lots.
flops at some point,
Yeah.
tons of times. My question is, how do you do it? Like, it's just terrifying.
You have to not care. You have to be perfectly fine with failure. I always wanted to do stand-up comedy. Like ever since I was a kid, I used to watch SNL and all the comedians, like way before it was appropriate for me to. My parents were very nice to me and let me watch all of this stuff. But I always wanted to, and I was like, oh, I'm never going to do it. It's terrifying. People won't like me. That was when I was 20.
Yeah.
And then you get a little older. I won't say how old. And you just go, I don't care.
Classic.
Because you have to not care and be ready to like put it all out there.
Yeah.
And then when you get that first laugh, that like really big laugh,
It's
oh
intoxicating.
my
rush.
gosh,
Adrenaline
it is
rush.
addictive.
Yeah.
I don't need alcohol. I don't need drugs.
I
I
just need
need
comedy
a good
and
laugh.
laughs.
Good laugh.
Yeah.
Yeah. Yeah. I just think you guys are courageous. Like, public speaking is hard for most people, I feel like, but then try and tell a joke with, who knows what kind of audience is out there. I mean, yeah.
Yeah, I think it was Seinfeld that said people's number one fear is public speaking. And that's ahead of number 2, which is dying.
Yeah.
So if you're at a funeral, more people would rather be in the coffin than standing up front giving the eulogy.
Yeah, that's true.
But it was definitely terrifying. It's less terrifying each time. And then you hear all the greats say that they've bombed and
Yeah.
did sets in front of quiet rooms or been heckled. So that kind of gives you a little reassurance that if all the greats were doing it,
Yeah.
and
What
they
made you
have
want to
bad-
do it, Dr. Ben? Because you seemed like you were pretty successful. You didn't
He's
really
a
need
good
a side
surgeon.
gig.
He's a great surgeon. Yeah.
well,
I don't know
and
if you guys
then-
know this about Dr. Ben. He's a very well renowned. You've operated people in the hospital. People like coming to you. So I send you patients all the time. But yeah.
I guess it was mainly, I heard an anesthesiologist tell a dad joke. And I thought that was so funny. It was actually an anesthesiologist said, your next patient wants to do his own anesthesia. So I told him, go ahead, knock yourself out. And so then I was retelling that joke and getting a lot of mileage out of that. And people were laughing. I'm like, oh, this is kind of cool.
Yeah.
Because as Brinn and Dr. Jameil can probably tell you, not everyone can tell a joke.
Yeah.
Even
Yeah.
and you've noticed people try to tell jokes, and it's like there's a certain skill set to that.
Yeah. Absolutely.
So then I had to get another dad joke because I can't keep reusing the same one, and then one led to another, and so I was
Start
just
making
kind of
your own.
right.
Yeah.
And then the chief of staff at the hospital wanted me to perform stand up at a medical staff meeting, and I said I'm not a stand up comedian. I just tell dad jokes, and
Yeah.
so I thought, well, you only live once. So I wrote a little 5-minute set, and I thought I was going to have a panic attack. That was
That's so fun.
So I've
I
seen
love
you over the last 2 years now that you've been in
Right.
Zanies. And like the last one I thought was your best performance I've seen because you didn't care. I could just
getting
tell
more
you didn't care that
Brinn
much.
was saying.
Yeah.
You just have to go out there. You know you're funny. You just have to convince the audience of that.
You just ripped through it. It was great.
And I'm very scientific too, so I kind of just try to think this is like an experiment. You're telling a
Yeah.
joke.
Yeah.
If you don't get the response you want, well, let me see. What can I switch to tell it better? Or
Yeah.
work on the
You're a
timing or
surgeon.
deliver
You
your
slice
content.
out a couple words here
Right.
and move something over
I like
there.
it.
Yeah.
So it's kind of like an experiment. It's not that you bombed or that you failed. It's just part of the experiment. Well,
How
what
long
can
ago
I do differently?
was that when they asked you to do that 5-minute?
That was summer of 23.
Oh man.
And then someone...
And in 2025, you were named Nashville's funniest comic. Look at that. Look at you.
Nashville's
That's
funniest comic.
amazing.
It was just a little 96 comedian competition. It wasn't anything too...
nothing too large. Yeah.
Yeah.
Several different stages and audience voting and panel of judges, but that was fun.
Where do you come up with your material?
Well, I have children, so that's a lot of it.
Plenty.
And I'm
Yeah.
also a teacher.
She has a lot of family oriented.
I do. I have a lot of family stuff about my kids, and kids say crazy
Yeah.
things.
Yeah.
And then, you get a lot of excuses as a teacher. So I have a lot to draw from there. And then I'm from Florida. I mean, tons of stuff
That's
there.
the epicenter of crazy things.
Yeah. No less than, and I always joke that there's no better way to become a stand-up comedian than the way that I was born. Have you heard this one, Dr. Ben, how I was born?
No,
tell the listener.
Yeah.
This is a good story.
I was literally, my mom had been to the doctor that day. And they said, they took a look and they said, she's pushed all the way back up. Like, she's not coming anytime soon. And then in the middle of the night, my mom got up to go to the bathroom and my head came out.
Oh, no.
Sitting on the toilet. The very first thing that I saw in God's
So
green
many
earth
things I wanna
was
say
the
right
inside,
now.
right? Yeah. So I joke that my dad, from that day on, he never called me by my name, Brinn. He just always referred to me as number 2.
Were you the second child?
I was also.
Oh,
so it worked on lots of
She has
levels.
perfect number
Yeah.
2. Oh, that's good.
So that'll do it.
How do you live that down? That's awesome.
You embrace it.
Yeah.
Yeah. I told my
great.
kids that story. I told my oldest daughter that story. One time she hadn't gotten the part that she wanted in a play, and she was just beside herself, and nothing I said would console her. And I was like, honey, do you want me to tell you a funny story? And I told her, and she immediately turned around. And this before I was a stand-up comedian, as well. But I logged that. I was like, okay, that's a good one. I'm gonna tell. And then she started telling anybody that would come to the house. I think she was 8, And every time somebody came to the house, they were like, hey, do you want to hear a story about how my mom was born?
So when
She
you
got
were
good at
pregnant, were you like month 9, like getting ready to just avoid bathrooms
I
at
knew
all
it was
costs?
a possibility. Yeah, I absolutely did.
Yeah.
And then my sister-in-law was a nurse, and she told me that her number one fear, not to do another poop joke, was that she would poop on the operating table or whatever. And so then that's all I could think about.
So not talk more about poop, but the reason
We do have a general
the
surgeon.
reason
Okay,
I,
this is the poop
exactly I'm
episode.
guts and butts. It's like what I do.
Guts and butts.
Oh my goodness.
But yeah, the reason I didn't do OB was because I just couldn't. I don't know. It's graphic. You think general surgery is bad, hemorrhoids and intestines and stuff. But
I don't know how men
I
can
love
do
OBs. They're great, but man, yeah, it's a lot of fluids in one 1 hour period.
If they call natural birth deliveries, how come they don't call C-sections takeout? That would be my question when I have OB on the.
It actually
That's
makes
a good one.
sense. Yeah.
Right,
Yeah.
we should have delivery and takeout.
You got to take it out. That's right.
But as far as gathering in material for comedy, becoming a comedian certainly has made me more observant to things every day
Small
that you might
things.
just
Yeah.
pass up. And because there's comedy in everywhere you look, you just have to look. And so a lot of times before that, you just kind of went through your day and you weren't very observant. But now I'm kind of on the lookout for, is there something in that? Or make a little note of it, or you pass a funny sign.
Yeah.
Or,
Do you guys have a process for vetting jokes out before they even make it to the stage? I know you try some at work sometimes and
right.
stuff like that, but how do you?
Open
You're not going to
mics
try the
or-
student jokes on your students,
Yes.
obviously.
Yeah. If I make my students laugh, either it's time for grades to be posted or it's a good one,
That's right. That's good.
But yeah, I try them out on my kids, and then we have open mics. And so you have to, because you really do have to do it on stage, but you go to an open mic and it's a room just full of other comedians. Nobody's going to laugh. Hardly ever is somebody
Right.
going to laugh because they're all thinking about
Hospital
theirs.
call real quick.
Doctors get excited when patients poop.
Yeah.
So
It sounds like there's just as much excitement for poop as for your job as being a mom, being a young mom.
They're
Right?
potty
That's
training.
true, yeah.
Kind of like potty training. You
Oh,
did
they
it.
poop.
You did
That's
it.
awesome.
We get
Number
excited
2,
over
yeah.
dropping a deuce.
Yeah. So, Dr. Jameil, you are also known as the gastric guru, the bypass boss,
That's a good one.
the waster whisperer.
Okay.
The
I'll take
waist.
that. Well, one good nickname I get from a lot of my patients, they're like, I tell my friends that you're my fat doctor. And I'm like, am I supposed to take offense to that or what?
Right.
I
Because
got
you're
little
a
extra
fat
weight.
doctor or you're the fat doctor.
Uh,
What about like a pH? Or nobody's old enough for that? Or
You gotta
pH
explain.
doctor, the fat doctor with a pH.
Oh.
PHAT.
Yeah,
That's
yeah,
like a good.
like she got a fat.
Never mind.
Okay, got it.
Never
Pretty
mind.
hot and
I've just
tempting.
Yeah,
just
that's
aged myself.
That's right.
Millennial over here. I'm sorry.
Oh yeah. Okay. I'm the elder millennial, so
got it.
I'm just on the other side
Wait,
of it.
so let me ask you one more question about comedy.
Yeah.
Because, our road is, I want to be a doctor, so I'm going to go college, med school, residency, fellowship, find job.
Mm-hmm.
So if I was to say like, okay, I do want to start comedy, and I actually did make a list of like topics I started to observe, and then I just, was like, I'm too scared for this. How would you tell someone to do or get this started? I mean, we heard Dr. Ben's path, but like, what's your...
Just be willing to work for chicken wings. And no.
That's right.
All you have to do is
for
sign your
chicken
name to a paper. No, sorry.
Is there like
if
a
you can sign your
process, or-
name.
Yeah, if you can sign your name up on an open mic and not care what people think about you. But yeah, I mean, just writing down all of those things, going
And then
to
you
an
start
open
networking,
mic. Yep.
meeting other comedians that do shows. You'll meet like a Brinn who produces a show and like, hey, you're pretty funny. Why don't you come on my show at Just Love?
Yeah. Thanks for the plug.
Nice.
And then you start networking and building and making yourself available and coming up with good material and being funny and friendly.
Yeah. Nice. Okay. So it's just that
Kind of
organic.
networking.
Yeah.
But usually, traditionally, it's like an open mic where you would start.
That's like the med school of...
That is
getting in.
the residency.
Okay.
Yeah.
Yeah. It's probably the whole thing's residency for a while.
Yeah. I
Brutal,
wasn't kidding
lot of
about being paid in
failures.
chicken wings for a few years.
And then hopefully it grows and you're like a guest on someone else's show or a feature.
Or a
on,
famous doctor's podcast. Or
or we're going to launch careers on this podcast.
That's right.
But you'll maybe host for somebody's show or be a guest or a feature and then
and then eventually you can headline.
be a headliner.
When you get to that 45 minutes to an hour, then you can be a proper headliner
Yeah.
at a
That's
real
amazing.
club.
Yeah.
So
That's awesome.
That's kind of traditional.
progression.
I think probably most of the comedians.
Yeah.
So I'm trying to bypass all that. No.
Gastrically or
Right.
Sorry.
On the
The
bypass.
switch.
Yeah.
He's switching it up.
Switch.
He's
Well,
taking
kind of
the
like Jake
duodenal
Paul.
switch.
He probably didn't go through the traditional route of becoming a boxer.
Is he a boxer though? I don't
well,
know.
but he's kind of bypassed all that, and now he's
Yes.
getting paid
Yeah.
much more than most boxers.
Yeah, I know.
So just marketing himself and
Be willing to hit
positioning.
people and
yeah.
and be hit.
Yes.
be hit.
I think he's
yes.
lost his last fight. So
All right, folks. Well, that's a wrap. I like to keep my patients and listeners in stitches. I think we have all the sutures in now. Thank you for joining with Dr. Ben and Friends podcast in the heart of Nashville. Remember, some of us are serious in surgery, but some of us can be seriously funny also. So if you've loved today's episode celebrating comics and comedians, please hit that subscribe button. You can find us anywhere you get your podcast, YouTube, Spotify, Apple, Amazon. And so your word of mouth, though, is our greatest support. So please tell a friend, share an episode. We'd love to hear from you and your friends who figured dad joke. And today we had the very talented Ms. Brinn Daniels. Ms. Brinn, where can our listener find you?
Well, I'm on Facebook, Brinn Daniels, and also on Instagram at Brinn Does Comedy, BRINN.
Yes, look her up. Very funny. Thank you. And then Dr. Jameil, thanks for being on the show today. Where can patients and listeners find you?
Yeah, so my social media pages are Dr. Jameil for Instagram, so DRJAMPEIL. I have a Facebook page for my practice, Tennessee Style Weight Loss, and I have a TikTok, Bariatric Bro.
Well, fit.
Very hip.
That's right. And then my website, TennesseeStyleWeightLoss.com, or if you just look me up on Google, I should show up high up there, SEO and all that stuff. And I have 3 offices, Hendersonville, Clarksville, and Murfreesboro. So come find us at one of our locations to talk about weight loss, or, another gallbladder out, that's also fine.
I love it. Thank you both for being on the episode. Listener, tune in next time when Dr. Ben and Friends will be putting the med in comedy. All right. Thank you.